Hello, welcome to another Topic Tuesday. This is Dr. Michael McCall at Source Health Center. I want to talk today about digestion, and by the way, we will end the talk with flatulence, because that's going to help you diagnose what's wrong with your gut. So remember where you heard it. The hardest thing to diagnose in the Western Hemisphere is abdominal pain. The second hardest thing to diagnose is chiropractic. That's because most people that are diagnosing it may not be chiropractic, but let's talk about digestion. So there's all different symptoms that people are getting with digestion. The most common one we always hear about is GERD, gastroesophageal reflux disease, or what am I thinking? Heartburn. And actually the cause of that is making too little stomach acid, though a lot of the medications over the counter and prescription, which I can't talk about, are designed to lower the amount of output of hydrochloric acid from your stomach. So if you have burning like 20 minutes or later in your throat, that's usually that you're making too little stomach acid, and the over-the-counters, which I can talk about, will only will help you get the symptoms away, but what it does is pushes your digestion in a harder burden, because what's now happening if you have not enough stomach acid is you can't digest your proteins. When you can't digest your proteins, it's called putrification. So the proteins start to degrade and they start to rot a little bit because they're not broken down to little tiny amino acid components. And if you don't digest your protein completely and you get you take building blocks of protein are these little amino acids. You get 6 or more together, your body can create an antibody to it. So a lot of times you'll start creating an antibody to your food, which you really don't want. So what will happen is you'll have bloated right when you're eating is usually the case, or you have gastroesophageal issues. And one of the best ways to help that is actually don't mix your proteins and starches. So that's like anything that's a protein, such as an egg or meat. Don't think cheese and don't think beans. And if you mix it with the starch, such as rice and potato, bread or pasta, that combination is really hard on that digestion for the stomach. So if you want to eliminate those meals where you're having protein and a starch, which is like a meat and potato or a hamburger and french fries, is not the American way, but lots of Americans have this. So maybe there might be some connections, something to think about. Try that. A lot of times that can help out as well. And your flatulence will be really terrible smelling. Like wife is going to kick you out. Significant other is going to tell you you need to be in a different room. You have to watch out for that. The other type of digestive trouble is fat digestion. So that's usually your liver and your gallbladder. And sometimes those two can be confused when you go in with gastrointestinal problems. A lot of times it's hard to tell is it stomach or gallbladder. But if you have really intense pain and you're clutching the right side, more than likely you're going to be diagnosed with some type of gallbladder issue, and you want to work for that. So what happens then is, do you notice that you feel kind of discomfort or bloating right when you have a fatty meal, like if you have french fries or something like that? Do you feel kind of bloated? And you have to kind of, with the bloat, sometimes you got to kind of feel like let yourself feel that. The other part is your flatulence will be smelly too. Really bad. And generally women tend to have more gallbladder problems because you guys have to cycle through your hormones, which are cholesterol based. So you may want to look into those things. And the best thing to do is try to get lean on the meats and really watch the bad fats, which are trans fats. Trans fats are canola, safflower oil, corn oil, all of those types of oils. You either want to use olive oil or what have you. Now we have carbohydrates. Carbohydrates, out of all the farts, don't have any smell. So if you have carbohydrate farts, which is you fart and nobody really notices them, or they're not too bad, or oh, that smells like a baby flatulence, I should say flatulence. That's a carbohydrate, and a lot of times you're just not digesting your carbohydrate, which could be as simple as if you don't chew and let your saliva coat it, because it's the first form of breaking down that. It could be it, so you want to chew your food. So if you got smelly farts, don't mix your proteins and starches together, see if that makes a big change. If you still have problems, you may want to have your gallbladder looked at. So you go to your primary care physician and have that looked at. Sometimes they'll find it on liver enzymes. The GGP is what you'll look at for gallbladder. But a lot of times if you're a patient of mine, you have any of these things, you usually have this get looked at so that I can either help or get you to the proper doctor and the proper referral. So digestion, you got the fart connection. Life can't be much better than that. See you next Tuesday.